Hi there. Today I have the pleasure of introducing and having a conversation with Alexandra, our newest member of our health team. Hi, Alexandra.
Hi, Dr. John. Thanks for having me.
Thank you for joining us. Alexandra is a registered clinical counselor, having joined us from Calgary, Alberta, most recently. Alexandra, can I ask you to share with the viewers who are watching at home as a registered clinical counselor, what was it that made you choose the path of becoming a clinical counselor?
Thanks for asking. That's a great question. I actually always wanted to be a clinical counselor, and I had the opportunity to study in 2020 and finish my master's degree. But before that, I was actually a respiratory therapist in Calgary for 18 years, and that was a wonderful career. I always found there was a missing link in my healthcare career, though, and that was counseling. And what I mean by that is I'd see many patients that were going through a devastating diagnosis and that would come to me or to my team needing pulmonary testing, when really what they needed maybe to start was some counseling, which I wasn't able to provide at the time. So that inspired me to go on and complete my master's in clinical counseling, and here I am.
That's amazing. And as a registered clinical counselor, obviously your scope of practice and your focus centers around psychosomatic and mental health. Is there any specialized training or keen areas of interest in the realm of clinical counseling that you specialize in?
Yeah, actually, I really practice from an eclectic approach to counseling. And what I mean by that is I sort of pick different pieces from different modalities in counseling to really tailor it to the individual sitting in front of me. So that might mean I take something out of cognitive-behavioral therapy and a little bit from acceptance and commitment therapy, as well as if the client is presenting with trauma, maybe I go with some EMDR, which is eye movement and desensitization reprocessing therapy. So it's really tailored towards the individual, much like your practices here with the clinic.
That's amazing. We are super excited to have Alexandra join our team. Can I ask, sharing with the viewers again at home, why did you pick our multidisciplinary health clinic?
Sure, and that's an easy question. I actually came here as a patient when I first moved here and still continue on as a patient. And I just found that the clinic was a very warm, welcoming place with very knowledgeable practitioners. And I've had some very good results with what I needed here physically. And having all the different disciplines that are really important to holistic health on board now, as well having mental health, I just think it's such a great place for people to be able to come and tend to all their needs, whether it's recovering from physical ailments or needing some support with their mental health.
On behalf of the staff, I think I speak for the entire team. We are super excited to have someone with your clinical expertise join the team. I can see that you are really passionate about your profession as a registered clinical counselor. If you're interested to see if a registered clinical counselor can help you, please visit our website for more information or give the clinic a call. Alexandra, thank you very much for the discussion today and
Thank you
for
very
joining
much.
us.
I'm very happy to be here. Thank you.
Thank you.